Hello, my name is Stuart Wegenka, and today we'll be doing social phobia. It's a quick practical overview of social phobia, also called social anxiety disorder. In about 5 minutes, we'll define what it is not, show how it looks in real life, explain the anxiety avoidance cycle, and then finish with what actually works for treatment. The goal is education, not diagnosis. If this resonates for you or someone you know, the good news is it's common and treatable. Here's our roadmap. First, what social anxiety is and what it isn't. Then we'll look at symptoms across the body, mind, and behavior. Next, we'll walk through the anxiety cycle, how avoidance gives short-term relief but keeps the fear alive long-term. After that, we'll cover risk factors and when it becomes a clinical disorder. Finally, we'll end with evidence-based treatments and a simple next step plan. Social phobia is a persistent fear of social situations where you might be judged, embarrassed, or rejected. The core fear is negative evaluation. It's not the same as normal nerves before a presentation, and it's not the same as introversion. Introverts may prefer smaller groups but aren't necessarily distressed. Social anxiety is when the fear is intense enough that people avoid situations or endure them with significant stress. This can include avoiding meetings, interviews, or even making phone calls. Normalize. Many people experience social anxiety. Social anxiety is common. In the US, estimates suggest roughly 7% of adults experience it in a given year, and about 12% at some point in life. That's the key takeaway. You're not alone, and effective treatments exist. The goal is not to be fearless, it's to reduce avoidance and build confidence in functioning. Social anxiety shows up in three connected domains. In the body, racing heart, sweating, shaking, blushing, nausea, or tight chest. In the mind, thoughts like they're judging me, replaying mistakes, catastrophizing, or the spotlight effect. Feels like someone is watching you. And in behavior, avoiding situations, using safety behaviors like scripts, minimal eye contact, leaving early, or staying quiet. These domains feed one another. Thoughts trigger body alarms increase worry, and avoidance teaches the brain the situation was dangerous. Common triggers include speaking in class or meetings, presentations, interviews, meeting new people, eating or writing in public, being watched while working, and assertiveness, like asking for help or saying no. Some people primarily experience performance-only social anxiety, where the main fear is public speaking or performing, while other social situations are manageable. This is the anxiety avoidance cycle. A trigger happens, like a meeting. Thoughts show up, they'll judge me. The body alarms, heart racing and sweating. Then avoidance or safety behaviors kick in, leaving early, reading from a script, hiding symptoms. The key learning is that avoidance reduces anxiety in the short term, which reinforces it. But the long term, it keeps the fear alive because the brain never gets new evidence that I can handle this. Exposure equals gradual repeated practice, and it breaks the loop. Risk factors include temperament, like behavioral inhibition, family history of anxiety, experiences like bullying or harsh criticism, and major transitions such as a new school or job. What keeps social anxiety going is usually the maintenance loop. Avoidance means you miss learning experiences. Safety behaviors prevent you from discovering you can cope. Self-focused attention makes you monitor yourself instead of the conversation. And post-event rumination makes the memory feel worse than what it was. The encouraging part is learned behaviors can be unlearned. Clinically, it's more than nerves when it's persistent, often at least 6 months, when social situations are avoided or endured with intense distress, when the fear is out of proportion to the actual threat, and when it interferes with school, work, relationships, or well-being. If anxiety is limiting your life, it's reasonable to talk with a healthcare professional. Self-screens can be helpful for awareness, but diagnosis and treatment planning are critical. The most effective treatments are evidence-based. First line is cognitive behavioral therapy because it targets both thoughts and behaviors. A key component is gradual exposure, practicing fear situations in a planned way. There are also guided self-help CBT programs in some settings. Medication can help too. SSRIs are commonly used. Some people do best with therapy alone, others with medication, and some with a combination. The active ingredient is repeated practice, especially reducing safety behaviors. So, the brain learns, I can cope, and the feared outcomes usually don't happen. Here are practical next steps. Skills. Slow breathing with a longer exhale, labeling thoughts. I'm having the thought that, and using self-compassion language instead of self-attack. Practice plan. Make a fear ladder from easier to harder situations. Do small exposures 3 to 5 times a week, and drop one safety behavior at a time. Track what actually happened. Most people overestimate how badly it will go. If you want reliable sources, NIMH and the NHS have good overviews. And if you're in crisis or at risk of harm, seek urgent local help. Social anxiety is common, learned, and treatable. Small steps repeatedly, consistently make the difference. And thank you for my presentation.